In anticipation of your upcoming surgery, we try to make it very straightforward and easy for you to understand all the instructions before and after surgery. So I'm going to review some of those. A lot of this you'll go over in person either with me or one of my nurses or my PA before surgery at your preoperative appointment. So we will give you a sheet which is kind of like our booking cover sheet. It will tell you what date the surgery is, what time to arrive at the hospital which it's at, the entrance to go in, some basics, whether you need preoperative clearance or an appointment with your primary doctor, and whether you need any blood work or an EKG before surgery. We also like setting up your after surgery appointment at the time of your preoperative appointment so you know exactly when to come in back into the office and you're already on the schedule. For almost every surgery except for facial surgery, I do have everybody wash their body with a preoperative body wash. We'll give you a prescription for it. It's over the counter, but I give you a prescription in case you can put it under your insurance. It's called chlorhexidine, also known as Hibiclens. And what this does is it decreases the bacteria on your skin to lower any chance of infection for surgery. So we'll also give you an instruction sheet which states exactly what I'm going to state now. So once you fill this, you use it the night before surgery and the morning of surgery. You use it as if it's a body wash in the shower, and you put it on your loofah or your bath sponge. You want to wash whatever area of the body we're operating on, but you could actually wash the entire body as well, from the neck down. You don't want to get this in your eyes or your mouth. You want to let it sit on you for 5 minutes in the shower to kill all the bacteria, and then you can rinse it off. So you do that the night before surgery and the morning of surgery, so twice. And after you're done the morning of surgery, you want to make sure not to put on any lotion, powder, deodorant, antiperspirant, hairspray. You really don't want to put anything on your skin, and you just want to leave it nice and clean for surgery. We will also review your preoperative instructions, which are your before surgery instructions. We have this all printed for you, and we'll also send it to you in an email. So before surgery, you want to avoid aspirin, Advil, Motrin, Aleve. All of those things are known as NSAIDs, and they can thin your blood. You really want to avoid them from 1 to 2 weeks before surgery unless otherwise indicated. If you are on a blood thinner or even aspirin for a medical reason, as if you have a stent in your heart or a stent in one of your blood vessels, or you have a coagulation problem, then we will give you further instructions because we will want to get clearance on whether we can stop it or we will tell you not to stop it. We will also have you hold any herbal medications that you're taking. A lot of herbal medications are not regulated by the FDA, and we don't even know exactly what they do in terms of bleeding activity. So especially things like fish oil, garlic, ginkgo, krill oil, ginseng, St. John's wort, we really don't know what they do, but those we do know that they thin your blood. So we'll have you hold those for 1 to 2 weeks before surgery. Also, if you can avoid red wine before surgery, that's a good idea because that also thins your blood. If you're taking a routine multivitamin, that's completely fine. You can continue doing that, but try not to take supplemental vitamin E. Supplemental vitamin D is completely fine. There's also a section on here for your prescribed medications. If you're taking prescription medications, then you likely have some medical problems, whether they're mild or severe. We will send you for preoperative clearance, and your primary doctor will be the one to instruct you whether to take your diabetes medications or hypertension medications so that you know which ones to take before surgery and even on the day of surgery. There's some basic instructions on here, but when it comes down to it, we will have you follow the instructions of your primary medical doctor. In terms of diet, nothing to eat or drink after midnight. This is for anesthesia reasons. The anesthesiologist will cancel the case if you ate or drank anything that morning. So really after midnight, you don't want to eat or drink anything. If you do have to take any of your pills, you just take them with a sip of water and that's it. If you do smoke, we will be very strict and have you stop for 1 month before surgery and 1 month after surgery. We often will send you for a nicotine test to make sure that all of the nicotine is out of your system. You also want to try to avoid any secondhand smoke, so if anyone that lives with you or is close to you smokes, that smoke can almost be as bad as you smoking yourself, and it can have profound impact on healing and infection. So we will have you completely stop smoking, and we'll test your blood to make sure that all the nicotine is out. Here are a few tips before surgery, and on the day of surgery, we will give you all of these instructions and have you read them ahead of time. If you have any questions, please contact our office.